Climate change is irreversible. I'm very happy to see that Kazakhstan is very serious about it, very well accepted fact that it is damaging the country, and children suffers much more than adults. But we would ask them to invest on a program that will take a little longer, but it will be sustainable and contribute to a human capital of the country. The key lessons learned is working with the local authorities where the problem is, not to the central government. The new challenge, emerging challenge, and online safety, because we can't imagine that we children without internet, because internet is a huge source of learning. However, it poses a huge risk for the children.
How UNICEF is planning to address these challenges? Welcome to the Astana Times YouTube channel. We are at the UNICEF Kazakhstan. Dr. Sarwar, thank you very much for welcoming us here. I want to start our conversation reflecting on the 3 decades of the work of the UNICEF here in Kazakhstan. Our country has made a notable progress during this 3 decades in safeguarding children's rights. But of course, I'm sure it's not perfect yet. In your view, what are the most pressing challenges still faced by children in Kazakhstan? And how does UNICEF plan to address these challenges?
Thank you, Aida, very much. And it's a privilege to have you here in UNICEF office and talk about children. And that's what we love to do. You're very right. Kazakhstan went through a very speedy progress on well-being of children. And since 2006, when country started harvesting the resources. And then all aspects, you just take it, mortality, access to education, social services, and immunization, we are doing great. Great is always a relative term, but Kazakhstan has some, I would put challenges that are 3-dimensional. Kazakhstan is 9th largest country in the world and very diverse community. And the first challenge is geographical, physical challenge to provide a quality and very accurate services for every child that we talk about, UNICEF for every child. So that's a challenge for the government to extend the services for every child wherever they are. We say, a child is child, no matter where, no matter what. That's a physical challenge that many government faces, but Kazakhstan is trying very hard and effectively to address that, but we will need some time. Another challenge is also a natural challenge that came like a storm for the last 10 years, which is climate change, because climate change is irreversible. I'm very happy to see that Kazakhstan is very serious about it, very well accepted fact that it is damaging the country, and children suffers much more than adults. We have 55% children has water scarcity in the country. We have children suffers in pollution, the environmental diseases, environmental health. Look at that unfortunate flood this year. How many tens of thousands children were displaced. Their livelihood were displaced. They didn't go to the school for a while. That's interruption of their not only education, but interruption of life. This is a challenge, and I think a challenge of 21st century. Other challenge related to modern world.
Yeah, I wanted to point out to the fact that 3 decades ago, challenges were different from what we have now.
Absolutely. Yeah. Yes, because 3 decades ago, we were working hand to hand with the government last 30 years to provide basic services. But that's we have been doing it. But now there's the new challenge, emerging challenge, and online safety, because we can't imagine that we children without internet, because internet is a huge source of learning. However, it poses a huge risk for the children. We have to accept that. And when we did a study with Ministry of Education, we call it Kids Online in Kazakhstan, where it says 21% children has experienced cyberbullying. It's 1/5. 12% children reported that they saw images of sexual nature from a completely unknown person. 7% of the children received explicit sexual messages. 1/5 of the children, 21%, children were ready to go and meet somebody completely unknown without informing anybody, no parents, no friends. These are the challenge, because this is very much associated with whole child development. It's mental health, direct challenges. It's educational outcome, obtainment, results, because they spend more time online, and they are very much diverted from social life. So that's one. And then linking to that, mental health. Mental health is the epidemic in the world, global. Unfortunately, Kazakhstan, we are with one of the top.
Mm-hmm. So especially among children.
Adolescents, children and adolescents, 13 to 17 years old. Let me also give credit to the government, that government has acknowledged this top seriously. We are working with the different stations of the government, ministries, Deputy Prime Minister's office, and other partners. These are not easy to solve in one day, but challenges remain challenges. And we have to save our children, because our children is the human capital of the country. Mm-hmm. I could name many others, but these are key ones associated with the modern world, physical and geographical calamities.
But what about how UNICEF is planning to address these challenges? Maybe there are some initiatives you can name, or some work, even routinely work, that is being done to, like, let's talk about cyberbullying, how it is addressed.
Plenty of things being done, because first of all, knowledge generation is very important. We do continuously take pulse of the issue with the government. We do researches, and we do data evidence-based programming. We work with Ministry of Education. We are working on school psychologist issues. We work with Ministry of Health. Let's say now we do have patronage nurses system, home visiting. 10,000 home visitors in the country, and they visit 5 times a year to a family. We are embedding a mental health module into their curriculum, so that they go and check children what's the psychological status. One important thing that we will talk, and this is very cross-sectoral, is parenting, because parents are the primary responsible person for a child's well-being and development. That's what we believe. We need to equip parents with knowledge, equip parents with proper guidance, so that they are friends of the children, not they're policing the children. I worked in many, many countries in the world. Mm-hmm. One thing I could mention, that my time in Malaysia, when I was head of UNICEF, we did the same online, children in online. Mm-hmm. And we gathered about 45 children from different parts of the country, and we put them into a hall room, and we asked them to communicate. And it was surprising that they were communicating in 38 different communication channels.
Wow.
I knew only 5 of them. I don't know how much our parents knows.
You mean like they use 38 over 30 different online platforms?
Exactly.
Oh, wow.
Exactly. So how many parents knows in which platform their children are chatting? Mm-hmm. And this is one of the key issue, that parents, first of all, they spend not enough time with their kids. And that's why the kids start talking to other people. Parents do not have time to lovey-dovey and be friends. That's why children try to find friends outside. And the people outside online, not necessarily they all are friends. So this is something that we greatly need to boost further in all sectors, in the school, in the society, in the community, and at homes.
Mm-hmm. When it comes to expanding corporate partnerships in child welfare, you've emphasized the role of corporate partners in advancing children's rights. Could you elaborate on how UNICEF in Kazakhstan plans to engage corporate partners when addressing different challenges that we've discussed more effectively? Are there examples of previous, engagements with business? And the other question, how business is reacting? Are they willing, or they're like, okay, we're going to do it just to be a socially responsible for, to keep up with the good image?
Right.
Yeah.
No, you may know that UNICEF works in 190 countries in the world, and almost 80 years. It would be 78 years, if correct. And we are the largest UN agencies working with business. Let me bring global to local.
Okay.
That we engage not only with corporate, but with individuals. Because at any given time, you will see about 30 to 35 million people in the world are UNICEF donors for $5, $10 a month. Because it's a big money, because that's why we run the program all over the world. It's also engaging individuals to UNICEF program. And if I talk about Malaysia, we do have, at least 3 years ago, we did have 170,000 individual Malaysians were contributing $11 average per month, just transferring $11 to UNICEF. That's big, and it grew for years. So our dream in this office is to bring people, Kazakhs, because Kazakh people has traditionally very generous. Mm-hmm. There is a donation culture, there is a giving culture. We're very hospitable. If I go to any Kazakh family, they will put everything on the table for me. This is a hospitality. And giving culture is also a hospitality culture. So we would like to grow that culture here so that people contribute, people engage to their child development in the country. We have seen a huge progress that Kazakh people are contributing to our global call for Gaza, for Lebanon, the local calls, campaigns. So we are sure that we will have that. For corporates, we just recently had a very successful fundraising gala dinner where we brought enormous amount of people, entrepreneurs, young CEOs, and we spoke about children, we spoke about giving culture. We would like to create a giving culture a little bit more long-term, rather than very specific, building a school or building a hospital, giving some equipments, but we would ask them to invest on a program that will take a little longer, mm-hmm. but it will be sustainable and contribute to the human capital of the country. Like we were raising money for children with special needs, special educational needs. We have 188,000 of such children. We were talking about, okay, let us try 2,000 children at the beginning. Please donate, but result will come in years. I cannot say that these children will immediately become genius or got all educational outcomes in 1 year. This is a sustainable long-term contribution for the society, for the children. We will be working with corporations so that the employees of the corporation also has a contribution to a particular cause that we could put forward. So I see Kazakhstan as a huge potential, and this is something that whole office is excited, whole team is excited, and I could talk to you in 6 months, 1 year time. How do we do?
Okay, I will keep your word for it.
Absolutely.
I would like to ask you about the lessons you could share from the refugee response operations in Poland.
Sure.
Having led UNICEF's refugee response in Poland, what lessons or strategies from that experience do you find particularly interesting when addressing issues here in Kazakhstan?
So when we started our work, we had about 3.6 million Ukrainians in Poland. I never saw such a solidarity that Polish people and Polish government showed, because they opened their houses, their schools, their sports buildings to accommodate our children. And 94% of those who crossed the border were mother and child. So we selected 12 big cities where they are based in, and we invested on local authorities. We invested on mayor's office. We supported financially, technically, our knowledge-wise, so that children has access to school, access to health facilities. Children has proper psychological counseling with Ukrainian psychologists. But the key lessons learned is working with the local authorities where the problem is, not to the central government. We also work with the central government, but local authorities made the difference. And here we also, my lessons learned is that to follow the issues where they are. We know that our big cities and small cities needs to be more equally improved, developed, but we do have some issues there.
Why I ask this question, because we started our conversation and you've mentioned that one of the big challenges that Kazakhstan faces is this spread,
Exactly.
the geographical, physical distance among children in remote areas that
Right.
most often need more care, need more
Absolutely.
help rather than, children in big cities.
Right.
Children in big cities maybe face other challenges.
But they have more advantages.
Yeah.
Yeah, that's what we're...
But I think, okay, I will come back to my other point, but... Yeah.
Good. No, I just bringing that experience here is that we will be working in next coming years also, with the central government, but also with the local governments. Local governments will have more of us to work with the local priorities, solutions, because we don't need to invent wheels if it's invented somewhere. We just adjust it. And that's where we have experience of 190 countries. So we will bring ourselves to local authorities that please, let's work together so that you can readjust your priorities and maybe some budget reallocations, and we will help you out. And that's a way that we will reach, we'll go more closer to where the situation, where needs further improvement.
Mm-hmm. It's just I wanted you to maybe elaborate more. It can be on the record, off the record, because I kind of thought that if children in remote areas, they have different challenges with children in cities. But I feel like parenting in a small town where you don't have to work tirelessly, even on the weekends, like in the big cities, more very often happens to women, to fathers. And in the cities, children see their parents much less. Do you think there is some truth to it or not?
I think it's a both way around, but big cities, children are privileged. They don't see their children, parents more, but they see the park, playground. They go with their friends. Even in the winter, harsh winter, they can go to a shopping mall and hang around with their friends. That's a mental health. That's a child development. So either way, they are in a conducive environment. Mm-hmm. But when you go to a small city, if you even see your parents, parenting, I would love to talk about parenting in more details, but how much the parents pay attention to their children, what the recreational opportunity the children have in the small cities. Do they have enough information about choosing their future career? All these things. So I think here that distance works, not in favor of them, and many other environments not. So I think that the cities, big cities, children are better off due to many other factors. Mm-hmm. And that's why the developmental, the gap, we need to decrease, because government is doing a lot, no doubt, but it takes time, mm-hmm. basically, and it also depends on local authorities, how much you prioritize, which sector you prioritize. If you prioritize economy and tourism, or you prioritize education and social services.
Yeah, it's going to be different. Yes. The outcome will be different.
Exactly.
Let's talk about early childhood development and education priorities. Of course, Kazakhstan, I always say Kazakhstan is a very social-oriented country. The government also is the same way. So it prioritizes this area. Even though we say that Kazakhstan has made strides in education, there are still some, work that needs to be done, disparities that remain in terms of early childhood education, again, particularly in rural areas. So what steps will UNICEF take to close this gap, and how do you envision collaborating with local authorities that we've discussed earlier?
I mean, you're hitting the nail, because that's one of the things that I think we are talking more. Let me express my happiness that over 90% of the children goes to preschool. But then preschool is 6 years old. But science, neuroscience has developed last 10 years at the speedy level. We know exactly almost every neuron in the children's brain. It is confirmed that first 1,000 days
1,000 days.
3 years, mm-hmm. is the most important for a child brain development, because the connections are so speedy. Neuron is our hard drive, right? Mm-hmm. It's a gigabyte, terabyte, whatever other bytes.
Million bytes.
Exactly. And they keep information, they save information. So if your neurons are healthy, their bytes are more higher. And first 3 years, the brain development are crucial. Mm-hmm. And that's the time we need to save children from often diseases, because the immunity goes down. We need to save children from different harmful behaviors. We need to work with the children. And brain development doesn't happen like children is healthy. You need to talk. It's parenting is more important there. How much you cuddle with the kids, how much you talk, and then the brain works, eyes smile, children laugh, and that is the development of a child. So we now need to know how many times a father talks to a daughter. Maybe father talks to daughter more than son, but a father talks to child because he's busy and all.
Yes.
But this is important to see father and mother same in front of the children. A little kid of 6 months. That's very important. So we're talking about early childhood development, early childhood initiation, breastfeeding. Breastfeeding, breast milk is the best protection. That's very true. Our breastfeeding rate is below 40%, and it may not be the exclusive breastfeeding. How much we keep the children warm. So the whole early childhood development is the important, and I would say most important to invest on a human capital, invest on a country capital.
And I think it's very important that how mother feels herself
Exactly.
when she is with child. Does she have all her basic needs met? Does she have a good and supportive relationship with her family, with her husband or
No
her
doubt.
partner that she had a baby with?
Absolutely, because we need to see that a pregnancy process goes complete. You grew a human inside a human, so you need to protect a woman, pregnant woman, so that she dreams about the child. She has all necessary food, comfort. She has a love from the husband. She has a love from the family, from the mother-in-law and all. And her hormonal all development goes to the child. So it's a complicated process. I don't think that any science could replicate it ever, but very right. So mother has to want the child, and child has to be wanted in the family. So that's early childhood development. We need to also see that basic needs, immunization has to be met, because now, very sorry to say that the refusal of immunization vaccines are really high.
Let's talk about innovative solutions for health and nutritional programs.
Okay.
UNICEF has championed them worldwide. You worked in Malaysia, and maybe you can, tell us how you are, not particularly you, but UNICEF in general in Kazakhstan, plans to address them here in our country.
This is an emerging area of concern.
Emerging area. Why do you say that?
We do have today 20% of children are overweight. And we are working with the Ministry of Education and Health to look at the school meals. And it was interesting to learn that the menu that we are having in the school are very old. So what we are doing, and we have done some standardization of standard of school meals, because the government spends enormous amount of money for primary school feeding, $300 million a year. This is a huge amount. But we are doing a standardization of that process now. And also, this year, hopefully by next few weeks, we will work with Kazakh Institute of Nutrition, ministries, agriculture, health, and all, and we will have 4 or 5 different menus for schools
To choose from.
to choose from, localized, cost effectiveness and all, but nutritional value wise. As I said, 20% of children are overweight. If we do not handle it now,
Yes.
they will grow to obese. And obesity is a modern, I did not list the modern challenge of obesity, but
It
if
is
you
one of
ask
it.
me 2-3 years after, it would be one of my list. Because it's a snowball effect. And look at the countries, Gulf countries, US and Europe and all, children are obese, and you can't stop it. And it has got multi-dimensional issue, health issue, educational issue, economic issue, children's self-esteem, the multiple children are shy, they don't go out, they stay home, and life has changed. Life changed. So this is something that we really are concerned.
So we don't have a problem with being undernourished.
I mean, undernourished is due to diseases, that's normal.
But I mean, in the country in general, that people are starving, for example, or children are starving,
Of course
for
not.
example.
No, of course not. I mean, I don't think that Kazakhstan has any way to think about lack of food, but lack of maybe more nutritional food in the diet. That's something. Maybe more on, less balanced food because more on meat, or
Meat and fiber. I think that's the best.
carbs as well. So it's all about balanced diet, and that's. But I'm very, very happy that government has seriously taken it. Prime Minister has spoken about it. The President has spoken about school meals. So very happy that it went up to that priority, and it will shake the move.
Maybe you have an answer to this question, maybe not, but I will ask you anyway. Does UNICEF have the percentage, 40% carbohydrates, I don't know, 30% protein, 30%
It's not
fiber?
UNICEF.
No?
It's a nutrition has those ratios that UNICEF globally. We have a global standard. I can't tell you at the moment.
Okay, it's fine. I just wanted to. It's for
but
me.
I can provide you later.
Okay. Well, we came to our last question about accurate data and how critical it is for effective child-focused policymaking. How will UNICEF, under your leadership, support the government of Kazakhstan in strengthening data collection and analysis to better monitor and respond to children's needs in improving areas like child poverty protection and inclusion?
We are the data-driven agency in among UN system, and whatever we do plan evidence-based. We do result and monitor and evaluate and then move on. That's a core principle of UNICEF's work in any given country. And I'm so happy that Kazakhstan has very much similar mentality of working driven by data. One of our major data collection endeavor called Multiple Indicator Cluster Survey. This is the largest data collection exercise in the world. And now, this year, Kazakhstan and UNICEF, we are conducting the Multiple Indicator Cluster Survey. Even last month, we finished the field work. Let me tell you a little bit about it. This is the largest survey in the country for children. And we do have a sample size of 24,500 households. Means we were to visit 24,500 households to ask questions in all oblasts. and we achieved 96.4%.
96, wow.
0.4%, which is about 23,000. So it's a huge wealth of data. Why we did such a big sample size? Because we wanted to have national profile as well as oblast profile. Every oblast should have the same data set as the national, so that Oblast A to Oblast B to Oblast C we could compare. And that's the beauty of oblast planning. If an oblast said that my immunization is this, but here the problem is neonatal care, let's fine tune.
Yes.
So that's a beauty. And it has, we are doing it for 4 times last 20 years. So we compare apple to apple. We do not compare apple to orange. They're similar, they're both fruits, but they're not the same. So methodology, if you compare data, it has to be the same methodology, otherwise it's not comparable. So we are doing this 4th time in Kazakhstan, and this will give us the clear journey. How we started in 2015, 2012, 2028, and what is our journey of child well-being monitoring. So that's beautiful. We can talk about it in June when the data set will be ready and we will publish, and I invite you, we could look at it together. But this is the huge survey. I very much appreciate the BNS, the Bureau of National Statistics, and ASPIR's leadership on that, because they are the champions. They had about 180 enumerator went in every single villages, Mangistau to Aktau, Tauro, and everywhere. Their roads were not there, but they had to go there. And it's a dedication of these colleagues.
And to see that there is no road, that means that they can tell the local government that there needs to be one.
Exactly, because my colleagues went monitoring trips, and they said, Rashed, yes, there are needs in rural areas as well. So that I will be able to talk to you about it, how individual Oblast doing, how nationally doing, and what's the progress for last 20 years. Fascinating talk I think we will have. But yes, that's only one survey, but we collect data for many other ways. We do researches. We do research by topics. We did school meal assessments. We do a mental health assessment. Those are studies. This is a quantitative, that's more on qualitative. So any topics, we do action based on information, based on evidence.
Thank you very much for the interview, and I agree that data is important for the government to address any challenges with a precision, with approach, very targeted, knowing what we really need to improve. So it saves money, saves time, and it's more effective.
That's very important, because we do not need to go around shoot the right points. And thank you very much, Aida. It's a pleasure talking to you.